Tuberculosis, TB, is a disease that has plagued humanity for millennia, yet it remains a significant global health concern today. Despite advances in medical science and the availability of effective treatments, TB continues to affect millions of people worldwide. This article delves into the nature of tuberculosis, its impact on global health, and the ongoing efforts to combat this persistent threat. Understanding tuberculosis. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Primarily affecting the lungs, TB can also impact other parts of the body. Its ability to spread through the air makes it particularly concerning from a public health perspective. Transmission and infection. TB spreads when an infected person coughs, speaks, or sneezes, releasing tiny droplets containing the bacteria into the air. These droplets can remain airborne for hours, potentially infecting anyone who inhales them. This ease of transmission is a key factor in the disease's persistence and spread. Once inhaled, the bacteria typically settle in the lungs, where they begin to multiply. However, not everyone infected with tuberculosis develops active TB disease. In many cases, the immune system can contain the bacteria, leading to a condition known as latent TB infection. Latent versus active TB. Latent TB. Individuals with latent TB are infected but not symptomatic and cannot spread the disease. However, they carry a risk of developing active TB later in life, especially if their immune system becomes compromised. Active TB. In active TB, the bacteria overcome the immune system's defenses, leading to symptomatic disease. These individuals can spread the infection to others and require immediate treatment. The progression from latent to active TB can occur shortly after infection or years later, often triggered by factors that weaken the immune system, such as HIV infection, malnutrition, or certain medical treatments. Symptoms and diagnosis. The symptoms of active pulmonary TB, affecting the lungs, typically include persistent cough, often with blood-tinged sputum, chest pain, weakness or fatigue, weight loss, fever and night sweats. Diagnosing TB involves various methods including skin tests or blood tests to detect latent TB infection, chest X-rays to identify lung abnormalities, sputum tests to confirm the presence of TB bacteria, molecular tests for rapid detection of TB and drug resistance. Early and accurate diagnosis is crucial for effective treatment and preventing the spread of the disease. Treatment. The promise of antibiotics. The development of antibiotics in the mid-20th century revolutionized TB treatment. Today, most cases of drug-susceptible TB can be cured with a regimen of antibiotics taken over several months. The standard treatment typically involves an intensive phase lasting 2 months, using a combination of 4 first-line drugs: isoniazid, rifampicin, ethambutol, and pyrazinamide. A continuation phase lasting 4 months, using isoniazid and rifampicin. This regimen has proven highly effective when administered correctly and completed fully. However, the lengthy treatment duration presents challenges for patient adherence and can contribute to the development of drug-resistant strains if not managed properly. The challenge of drug resistance. The emergence of drug-resistant TB strains poses a significant threat to global TB control efforts. These strains develop when TB bacteria become resistant to the most effective first-line drugs, often due to improper use of antibiotics or incomplete treatment courses. 2 main types of drug-resistant TB are of particular concern: multi-drug-resistant TB, MDR-TB resistant to at least isoniazid and rifampicin, the 2 most potent first-line drugs. Extensively drug-resistant TB, XDR-TB resistant to isoniazid and rifampicin, plus any fluoroquinolone and at least one of 3 injectable second-line drugs. Treating drug-resistant TB is more complex, requiring longer treatment durations with more toxic and expensive second-line drugs. The success rates for MDR-TB and XDR-TB treatment are significantly lower than for drug-susceptible TB, highlighting the urgent need for new drugs and treatment strategies. Global impact and challenges. Tuberculosis remains one of the world's deadliest infectious diseases, second only to COVID-19 in recent years. According to the World Health Organization (WHO), in 2020, an estimated 10 million people fell ill with TB worldwide. Approximately 1.5 million people died from TB in the same year. TB is the leading killer of people living with HIV. The global distribution of TB is uneven, with the highest burden falling on low and middle-income countries. Factors contributing to this disparity include poverty and overcrowding, limited access to healthcare, high HIV prevalence in some regions, undernutrition, lack of resources for TB control programs. Current efforts in future directions. Recognizing the persistent threat of TB, the international community has set ambitious goals for TB elimination. The WHO's End TB strategy aims to reduce TB deaths by 95% and cut new cases by 90% between 2015 and 2035. Key strategies for achieving these goals include improved diagnostics, developing and implementing rapid, accurate diagnostic tools, especially for drug-resistant strains, new drugs and shorter regimens, research into novel antibiotics and treatment combinations to shorten treatment duration and combat drug resistance, vaccine development, ongoing efforts to create more effective vaccines for preventing TB infection and disease, addressing social determinants, tackling poverty, malnutrition, and other factors that contribute to TB vulnerability, strengthening health systems, improving access to healthcare and building robust TB control programs in high-burden countries, global collaboration, fostering international partnerships for research, funding, and implementation of TB control strategies. Conclusion: tuberculosis, despite being an ancient disease, continues to pose a significant threat to global health. The availability of effective antibiotics has transformed TB from a near-certain death sentence to a curable illness for many. However, challenges such as drug resistance, healthcare access disparities, and the complex interplay between TB and other health issues like HIV continue to complicate control efforts. The persistent nature of TB underscores the importance of ongoing research, sustained funding, and comprehensive public health strategies. While the goal of TB elimination may seem daunting, the progress made in recent decades demonstrates that it is achievable with continued dedication and global cooperation. As we move forward, it's crucial to remember that every life saved from TB represents not just a medical success, but a triumph of human perseverance and scientific advancement. By maintaining our focus on this ancient foe, we can hope to create a future where tuberculosis is no longer a threat to global health and human well-being.